I'm Mark Dresner, and this is Inside ePharma, a special interview series featuring experts and thought leaders at the forefront of digital marketing and media in the pharmaceutical industry. Inside ePharma is brought to you by the 12th Annual ePharma Summit taking place March 4th through 6th in New York City. Joining us today is Joe Shields, Global Strategic Marketing at Lifescan. Joe, welcome to Inside ePharma.
Thanks. Great to be here.
Let's start with a question that may not be clear to everyone listening, and that is, what does the term mobile health mean to you?
I think, there's a lot kind of wrapped up in that. I think the term mobile health tends to focus on the technology, so things like smartphones, things that make remote care delivery possible, remote monitoring, and things like that. So it's very kind of tech-centered, I would say, with the emphasis on mobile as opposed to health. Other terms that we've used, when I was at Pfizer, the word connected health, or the term connected health is a term that we use as well as many other organizations. There's actually a connected health conference at Partners in Boston. And that really, I think, describes the convergence of, 5 or 6 things: cost containment, empowered patients. It's very outcomes driven. So when you look at payers, they want to see that the interventions that are happening are working. They're technology enabled, but once again, this is not kind of the lead story here. The technology is really a support mechanism within this context. And then finally, there's ubiquitous connectivity. So things, have to be connected, particularly wirelessly, for the system to work. A new term that I'm starting to use, I think, is healthcare everywhere, or maybe healthcare anywhere. So if you think about it, healthcare has traditionally been delivered in 2 places: hospitals and doctors' offices. So there's a woman, Carolyn Buck-Luce, at PwC Consulting, and other people are talking about a 3rd place for healthcare delivery for patient. And this is made possible by smartphones and apps and remote monitoring, the consumerization of medical devices that we're starting to see, wireless networks, et cetera, et cetera. But what's really starting to change, I think, is the reimbursement for these types of interventions. So that, in the past where we had these kind of interesting, curious, apps and novelty items that nobody was making any money on, I think they're, with the reimbursement structure starting to change, things like telehealth are getting reimbursed, so you're going to see a lot more of it. So for me, healthcare anywhere is becoming the term and I guess a more accurate description that really encapsulates the technologies and trends that are happening.
You've given me a great segue into my next question, and that is, given everything that you've just outlined for us around mobile health and healthcare anywhere, as you put it, how is the role of marketers, generally speaking, in the pharma and medical device industries changing? What factors are driving that transformation?
Well, healthcare marketers were trained for the most part in what I call reach and frequency, and many programs that we set up today are still approached and measured in this way. But the transformation that I just talked about really requires a different mindset for engaging with healthcare professionals, payers, and patients. And I feel sometimes like we're in the middle of a bridge, with reach and frequency on the far side or the side that we just left, and then care delivery on the other end that we haven't quite gotten to yet. So, I have no training as a healthcare provider, but in my most current marketing role, I've designed medical devices, I've designed smartphone and tablet apps and other types of software to help support behavior change and improved health outcomes, and particularly in diabetes. So I've had to learn new skills and change my mindset to stay in sync with what our customers, including the payers, want from today's healthcare organizations. For example, I had to rethink my approach to patient adherence. When I look at programs I did 10 years ago, most of those were based on reminding people to take their medications. Today, it's just not enough. It's not enough for the patient, for the provider, or for the payer. Sustained behavior change and measurably improved health outcomes are really the name of the game. And the bar for measurement is not just higher. We actually are starting to measure different things.
Very, very interesting point that you've just made. The holy grail of marketing would be to affect behavior change, obviously, and that's also, of course, in many ways in healthcare, compliance.
But it's not just, I think in the past it's just been affecting behavior change when it comes to purchasing and repurchasing and kind of loyalty. The behavior change we're talking about now are, fundamental human health.
Right.
Once again, from a mind shift standpoint, I think it's a big change for marketers who are approaching it as a communications problem or a business problem as opposed to a human health problem.
So elaborating on that for me, what do you think healthcare marketing will look like in the future? How will it be different then?
Well, I think the biggest opportunity is in chronic diseases, and that, once again, is behavior change. marketers need to take a good look in the mirror and say to themselves, what do I want to do in the next phase of my career? Some people will certainly continue with traditional promotional activities that we've discussed, and there's certainly nothing wrong with that. Some may shift slightly, like I have so far, which is developing kind of these hybrid promotional / behavior modification tools, like smartphone apps and the like. And then other people may find that being in healthcare for them now means really being part of care delivery.
Right.
And they'll take their skills, their experience, their knowledge of consumer behavior, their knowledge of technology, and really start applying it to disease management, whether chronic diseases at a telehealth company, maybe at a medical software company or things like that. So I think it's an exciting time for marketers to kind of take a step back from, not only themselves in their career, but the healthcare industry, the healthcare system as it stands today. It's in dire need of change, in dire need of smart people with ambition to really dig in and maybe look at things a little bit differently. So it may require, once again, a different mindset. So if you're good at a different, or if you're good at one, kind of activity or certain skill within the advertising domain, let's say you're really good at making DTC commercials, or you're really good at CRM programs, and now the market is asking you to be really good at chronic disease management, that could be scary for some people, but I think for others it may provide a great opportunity and a different way to participate in the healthcare system.
Any final thoughts based on that, on how marketers can adapt to the sweeping changes taking place in healthcare? Any advice you might have for them, building on what you just said?
Well, I think most of us. The biggest piece of advice for me is never stop learning. Really take some time to understand why you're in healthcare. Why you're in healthcare at this moment. What you like about it. Maybe what you wish you could change. Because I think we all have talents and insights that we can bring to the healthcare system to make it more efficient, more caring, more cost-effective, and ultimately a system that keeps people healthy and happy. Not only for themselves, but for their families. I mean, that's something I think deep down that's what we all want. I mean, certainly we need to earn a living, but at the end of the day, I think there's a human desire to feel good about how you spent your last 8 or 12 hours working.
Mm-hmm. Joe, you've outlined what I consider to be a pretty extraordinary and seismic shift, a blur between marketing and healthcare delivery, if you will, the concept of healthcare anywhere, and obviously a terrific opportunity for people in conventional marketing roles to really expand their purview and their influence and impact. Thank you for a very insightful take.
You're very welcome. I look forward to the ePharma Summit in March.
Terrific, as do I. And for our listeners, that concludes this episode of Inside ePharma. If you'd like to hear more from Joe, he will be moderating a panel of experts on the subject of, appropriately, next-generation mobile health technologies at the 12th Annual ePharma Summit taking place March 4 through 6 in New York City. For more information or to register, please visit ePharmasummit.com. Until next time, I'm Mark Dresner. Thanks for tuning in.